if your family traveled, you have to assume that you were exposed and you became infected, and you really need to get tested in the next week.
Warnings from the nation's top healthcare officials after a record-setting weekend for holiday travelers. Indeed, the TSA reports Thanksgiving Eve was the busiest air travel day of the pandemic, despite health warnings. Yesterday alone, over 1 million people passed through U.S. airports. Back with us again tonight, Dr. Vin Gupta, critical care doctor specializing in these types of illnesses, also an affiliate assistant professor out at the University of Washington's Institute for Health Metrics and Evaluation. Doctor, let's begin tonight with news folks can use. It's estimated 8 to 10 million people, whether they admit it or not, were on the move in some form or fashion this weekend using mass transportation. Everyone's filtering back now. Homes, friends, families, if you're lucky enough, a workplace. What is protocol? What responsibility should they take on for themselves? Because I'm watching that 14-day quarantine target number kind of soften and shift as we go on through this pandemic.
Good evening, Brian. I'm glad you started with that. So I'll start with that as well. Here's what we know. Emerging data suggests that if you've been exposed and you know you've been exposed to COVID-19, or if you've traveled, like Dr. Birx mentioned just now, assume you've been exposed. And then on the back end, once you've reached your destination, act as though you've been exposed for at least 7 days and try to stay quarantined. That means masking in front of others that you might be living with. That also means minimizing all your essential, going out in public to only essential and or emergent activities. Try to minimize going out at all. And then try to get a test about 7 days after you've arrived. That's when we think that test is going to actually be useful. About 7 days after exposure, Brian, that's when we think if you've been exposed and infected, we think about 7 to 10 days. That time period is when if you've actually been infected with the virus, you're less likely to transmit it to others. So that's why the CDC and that's why all our public health officials are really revisiting that 14-day policy. That's one. Number two, if I may, I've seen way too many people still either face shield alone without a mask, thinking it's a substitute. That's just not the case. Face shield is great on top of a mask. And what type of mask? I've said this to you so many times. Not a one-ply mask or a thin mask. You want to get a thick fabric cloth mask, 2 to 3 layers, ideally, different types of cloth next to each other, or a 3-ply surgical. I'm going to keep showing this until this pandemic is over. 3-ply surgical mask. That's number 2. Surface cleaning, Brian. High-touch surfaces, bathrooms, kitchens. Make sure you're cleaning those surfaces, especially if you've had visitors often throughout the day. Hand hygiene is vital, and avoid indoor gatherings. That's critical. I'll lastly say, I've just been on service. I was on service today. The common denominator of transmission is within families, within households, and they're just surprised by it. They're surprised their loved one is in the ICU getting cared for with critical illness. They didn't know it because a family member inadvertently who was asymptomatic transmitted it to somebody who was more vulnerable. So household transmission is the way that this virus is transmitting itself across the country. We have to be really vigilant, especially amongst those who we hold dear, who we live with.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.